Hello everyone, welcome back to our second case study in the Code with Conference series. In your first case study, we explored an E&M chart. If you missed it, don't worry, you can find it in the cards above. Today, we are moving one step ahead and looking into a surgery chart. This will give you a deeper understanding of how real world operating notes are coded. And as always, this series is available in 4 languages, so feel free to watch in the one you are most comfortable with. Let's get started. As we discussed in the first case study, the very first step when you start your work is to review the chart carefully. Once your coding software is open, you will usually see two important sections. First one, the patient's medical document or chart. This contains all the details, diagnosis, and procedures. Second, the coding interface or entry tool. This is where you can select and assign the correct codes based on the documentation. Always remember, accurate coding starts with accurate reading. Now, let's begin with our surgery case study. Once you open the chart, the first step is to look at the patient demographics. In this record, we see gender male, age 84, date of service August 14, 2025. These basic details may look simple, but they're very important. They help us confirm the identity of the patient and ensure coding is done on the right medical record. Next, let's review the diagnosis and planned procedure from this chart. Preoperative diagnosis, history of colon polyps. Postoperative diagnosis, colon polyps, rectal polyps, diverticulosis of the colon, and hemorrhoids. The surgeon's planned procedure was a colonoscopy with snare polypectomy, which means removal of polyps. Additionally, the notes mention conscious sedation given for 31 minutes. These details tell us two things. First one, what conditions are being treated or found. Second one, what exact procedures were planned and performed. Now, let's look at the operating findings documented by the surgeon. The chart notes that the patient has a history of multiple colon polyps and diverticulosis. On examination, the prostate was found and internal hemorrhoids were present, and moderate diverticular disease were observed. Three small adenomatous appearing polyps were found in the rectum, each less than 1 centimeter in diameter. Additional polyps were found, one at 30 centimeter, one at 65 centimeter, and another in the cecum. These findings are very important because they confirm the extent of the disease, multiple location with polyps, the clinical justification for the procedure. Now, let's look at the technique documented in this operating note. After explaining the procedure and risk to the patient, the surgeon administered 165 mg of propofol IV for conscious sedation. A rectal examination was performed and then the scope was inserted through the anus. The areas was carefully examined. A cecal polyp was encircled with a snare and removed. The second polyp was also removed in the same way. Finally, three rectal polyps were also snared and removed. Once the procedure was completed, the instrumentation were removed and the patient tolerated the procedure well. In the above video, you can see exactly how the scope is used to identify and remove polyps step by step. Before we move forward, at ThoughtFlows, we are proud to be India's number one medical coding academy with 12 branches across India. You can join your nearest branch for direct classroom based learning and take your medical coding career to the next level. Let's summarize what we learned from this surgery case study. Always begin with patient demographics, age, gender, and date of service. Review both preoperative and postoperative diagnosis carefully. Identify the planned procedure and confirm it with the operating findings. Consider sedation time too. And remember, accurate coding is not about memorizing codes, it's about reading the documentation carefully and applying the coding guidelines correctly. After you finish reading the documentation, the next smart step is to make a note of all the codes you need to assign. This is a common practice followed by freshers to stay organized and avoid missing any detail. Even experienced coders in many companies who do the same for accuracy and efficiency. Writing down the codes first helps you avoid skipping important diagnosis or procedures. Double check your work before final submission. Build confidence in handling complex charts. After analyzing the chart, and making notes, here are the important codes you need to assign. CPT codes, colonoscopy, polyp removal, moderate sedation as documented for 31 minutes. ICD codes, polyp of colon, rectal polyp, diverticulosis of large intestine, internal hemorrhoids, and history of colon polyps. Now, let's come to one of the most important steps, how to search for the correct codes. In the CPC exam, we rely on coding books to look up the codes. But in a company setting, we use coding software tools to search and assign the codes efficiently. In this session, I will demonstrate how to use the software to search for the correct CPT and ICD codes for this case study. Remember, no matter whether you use books or software, the accuracy of your code depends on your understanding of the documentation and coding guidelines. There are many coding software tools available in the industry, but today I will show you an example using Find a Code software. Here you can search for procedures, diagnosis, supplies, and more all in one place. Let's start with our CPT code for this case. You can go and search CPT index, and the main term is colonoscopy. So just type the colonoscopy, you can able to find here. Then it shows like flexible follow-up stoma. It's a flexible. Next, objective of the surgery, whether the biopsy, diagnostic, dilation, we need to check. But in the document, it is a removal, right? So you can click the removal. And what we removed, polyp. It's not a foreign body, it's not a lesion, tumor, it's a polyp. Just click the polyp. And bottom, you can able to see the code description. Like the code is 45384 and 385. So one is hard biopsy technique and one is SNAT technique. So in your documentation, it is a SNAT technique, right? Just click the code 385. So you can see the description of the code. Colonoscopy flexible with removal of tumors, polyps, and other lesions by SNAT technique. And just like your book, we can find all the notes, do not report, use in conjunction, all the details you can find here. So this is how we had to take the code using a software. Now, let's look at how to code for moderate sedation. When coding sedation, there are few key things you must check in the documentation. First thing, who administered the sedation? Was it the same physician performing the procedure or a different physician? Second thing, patient's age, because codes differ for patients under 5 years and above 5 years. Third thing, time duration, since sedation codes are time based. In your case study, the sedation was given by the same physician. The patient age is 85 years old, so clearly above 5 years. The total sedation time is 31 minutes. Coming for the coding point, for the first 15 minutes, we had to use the code 99152, sedation initial 15 minutes, and age is above 5 years. For additional time, we need to take the add-on code, which is 99153, each additional 15 minutes. Once you have identified the correct codes, the next step is to enter them into the coding interface. Here you can able to see, right? This is one of the coding interface where you had to take all your codes into this. Okay. So first coming for the CPT. So our main primary procedure is colonoscopy with polypectomy. So the code is 45385. And along with that, they given conscious sedation. So we need to take the codes for conscious sedation. The code is 99152 for the first 15 minutes. And we had assigned the additional code, which is 99153. So we had to take the CPT codes, colonoscopy, along with sedation codes. Hope you got clear now how to search and assign the correct CPT codes. Now, let's move on to the ICD codes. You can find here a diagnosis. Just click ICD-10-CM. Then down we can find the index, guidelines, codes, table of neoplasm and drugs. So just click the index. Then you have to type the main keyword. So it's a polyp, right? Just enter polyp. So in the polyp of colon, just type colon. Just click it. Then you can able to find the code polyp colon. The code is K63.5. So this is the code we taken from alphabetic index. So you had to click it, it will open a tabular list. So you can able to find it polyp of colon, which is K63.5. Just like your book, we can find all the includes, exclude terms. So everything we can able to find here. Next ICD, we are check for the rectal polyp. Same index page, just click the polyp and rectum. You can able to find the code polyp rectum location, which is K62.1. Just click it, open the tabular list, and you can assign the code. So K62.1 is a rectal polyp code. Check for all the terms. Next code, diverticulosis of colon. In the index, just search diverticulosis. Next subterm, it's in large intestine, right? Just click the large intestine. You can able to find the code, right? K57.30. Diverticulosis, large intestine. So this is a code we got from alphabetic index. Just click it. It will open the tabular list and you can find the complete description here. So diverticulosis of large intestine without perforation or abscess without bleeding. So code is K57.30. And the next code is hemorrhoids. So just type the main term hemorrhoids in the alphabetic index. You can find the code here. And under hemorrhoids, you can see K64.9. So documented is the internal hemorrhoids, right? So you have to check for internal, which is K64.8. So once you got the code, just open tabular list and confirm it. So you can see here other hemorrhoids, and down nodes we have internal hemorrhoids. So the code is K64.8. Next ICD, we are check for history codes. Just type history. You'll find family and personal. So it's a personal. Then under personal, you had check for the colon. So it's a history of colon polyps, right? So it's a benign neoplasm. You can able to find colonic polyps. See history, personal, neoplasm, benign, colon. So that will leads to the code. So which is Z86.0100. You can able to find here, right? 86.0. Under that you had to you had to make the 7 characters, right? Complete ICD code. So just go for drop downs. You can able to get the clear code. The final is Z86.0100. So personal history of colon polyps unspecified. So most of the fresher we miss to take the Z codes and that will get a lot of errors. So try to avoid those errors. Once we have selected all our codes, the last step is to enter them correctly into the coding interface. The order for entry is very, very important. So you have to enter your primary diagnosis, which is a reason for your admission. So which is a colon polyp. The code is K63.5 and followed by the secondary diagnosis and additional diagnosis. After primary, you need to add all other relevant conditions which was documented. So you can see here, right? Rectal polyps, diverticulosis, hemorrhoids along with the personal history codes. By now, you have seen step by step. First one, how to read a surgery chart and extract all the important details. Second thing, how to search for codes using a coding software like Find a Code. Third thing, how to add those codes in the coding interface in the correct sequence. This is how a medical record is converted into standardized codes, which are then used for physician payment, reimbursement, data collection, research, and various reporting purpose. You were seeing how a real surgery chart is coded step by step. At ThoughtFlows, we prepare you for a successful career in medical coding with real case studies and practical training. Now it's your turn. Hello, wait. This is not just an entertainment video to watch and scroll away. It's about your knowledge and career growth in medical coding. So, if you really understand this surgery chart, drop your answer for this question in the comment section. Only then you'll know how confident you are in coding. Like this video if you really found it useful. Comment below with your thoughts. Share this video with your coding friends or anyone looking for a career in medical coding. This jungle of coding has separate channels in your favorite language, Tamil, Telugu, Malayalam. So, if you want to learn in your favorite language, check the comment section for your channel link. And hey, don't just watch and run. Hit that subscription button, smash the bell icon, or else the line will come roaring into your dreams tonight. So, stay tuned, don't miss the next chapter, and always remember code with confidence, roar like a lion. And if you are serious about your future, join us at ThoughtFlows, India's #1 medical coding academy. Start your journey today because coding with confidence leads to careers with confidence.